Hello everyone, I'm Dr. Mathur Hanif, Assistant Editor at Dental News Pakistan, and I'm so excited to welcome you all to this live session, COVID-19 and Oral Hygiene. I'm so thrilled to welcome our speaker, who is a renowned figure in Pakistan's dental fraternity, Dr. Marium Azfar, Head of Community Dentistry Department, Sindh Institute of Oral Health Sciences, Jinnah Sindh Medical University, Karachi. Please, Dr. Marium, join us in the video and hello.
Thank you, Dental News, for inviting me to organize a wonderful this live session, which is based on how to keep your teeth clean during COVID-19. The session is very simple. The objective is very simple. How we are going to control a plaque, because this plaque is responsible for a lot of oral diseases like caries, periodontitis, gingivitis, and teeth. And we know that in this scenario, most of the clinics in OPDs are closed for the routine procedures. So I would like to advise you and give some guidelines how to keep your teeth clean as a home-based procedure. Uh, just like a dentist, these are the brushing, flossing, irrigations, using mouthwash, and some tight counting. Uh, Even now, I can share some research that they prove that most of the time, systemic diseases have a link with our oral health. Like if patient is suffering from the periodontal diseases, they are more prone to have fatal heart attack risk factors as compared to others. Same here if the patient is having other oral disease or oral infections, they have risk of respiratory disease. And even we notice being dentists that most of the patients who are diabetic and they're having a periodontal problem, they face a lot of problems to control their diabetic issues. Now, in this era, in this pandemic era, the main is this: we are focusing on the thing this how we are going to store our things or store our utensils from virus or to prevent it from contamination. So before discussing the steps of different procedures, the first thing which I'm going to discuss is how we are going to store our toothbrush in the current scenario. So the first thing is this: we never keep our toothbrush in a closed container. Why? Because if we want to keep a toothbrush closed container, there will be a chances moisture in that, and because of that moisture, the bacteria will grow. So the wise decision is to we have to keep it in a open place or a lid which should have room, and we can only keep it in that thing if uh, we are in a condition of traveling, then we can keep it in a closed container, but make sure that it should be in a dry form. Then like we when we are going to keep a brush in a container, it should be bright form. Why in the bright form? That we always notice when sometimes at the base or the bottom of the container have some that is a layer of mud and some dirt. So if we keep a brush inverted, that is the bristles is towards that at the bottom of that container, there may be chances that may contaminate the toothbrush and the bacteria may transfer from that bristles to patient to a person. So always keep in a right position. Now the more important thing is we have no different even in our houses, like a lot of or multiple toothbrushes are stored in one container. I think in the current scenario, the best thing is this: every toothbrush should be placed in a separate container, and make sure that if even they are placed or two toothbrush or three or multiple toothbrush are placed in the same container, they should not touch with each other. Otherwise, they will allow for the transfer of bacteria and body fluid from one brush to another brush. Then a very important advice for especially for the kids, that they do not share their toothbrush with the body, because if they are going to share their toothbrush, with each other, there will be a chances of transfer of body fluid and bacteria, which can transfer from one person to another. um, Normal condition may there's no necessary that you every time using a toothbrush you keep in a any bacterial agent or any mouthwash or any chlorhexidine like thing, because in that case it is not recommended. But I would like to recommend in this current scenario that after using a toothbrush, it's a wise decision if you keep also in antibacterial agents like chlorhexidine in order to avoid the contamination before and after using. Now come to the procedures. Now first of all, brushing. So before starting brushes, as we have lot of knowledge nowadays regarding hand washing. So before starting the brushing, we should wash our hands at least for 20 seconds, because sometimes oftenly people usually direct go to take a toothbrush and take out a strip of toothpaste on the toothbrush and use it. But in that case, there may be a chance of contamination. In this particular situation, in this current, it's better to first wash your hands and then wash your brush also. How you brush your toothbrush? You have to tap it under the warm water, and the bristles is towards the tap. And then before using, you have to invert the toothbrush towards the sink so that drip all the water, and then use it. First, start from your posterior side, that is from the molars of uh, one end of the mouth, and keeping in the direction of the toothbrush, always keep it vertically, that is at the gum margins. From the gum margins, then give a rotatory motion and keep it at the 45-degree angle. Now you have to brush it for 10 seconds or like this, or 20 seconds for this, and then change the direction. In that way you can remove the food particles and related tooth surface at the margins. Now suppose you have to clean the surface of the tooth, you have to change the angle. Like instead of 45-degree, you have to leave the bristles at the surface of the tooth, and in this way you can clean the remnant of food particles which is swept from the gum margins, or they are placed at the gum margins and they are now coming towards the tooth surface. Now it is necessary to clean the lingual and the palatal surface or inside anterior teeth. How we are going to clean that? We can take the front portion of the cells and we can go and to and fro movement and clean it with this. Then the most important is that it's not only the teeth you have to clean, but you have also clean the entire oral mucosa. That is the entire oral cavity, including the oral mucosa, that is the inside of the cheeks, the palate, the dorsum of the tongue, the lateral border of the tongue, because some of the food particles, even the bacteria, they are present over there, which causes contamination, and they may lead to a bed bread or halitosis, which may cause gingivitis. So it's better to clean the tongue also at that time. Then once you have done the brushing, it's better to use a mouthwash. Even I would recommend in this video that you will use the mouthwash before and after the brushing. And how you do how you can use a mouth, it's always is given according to the manufacturer. And if you are using a mouthwash, better to use it um, in the form of diluted rather than a concentrated form. If it is recommended, you can use in a recommended form, in a concentrated form also. And you can spit it in the sink, then again the gargles at least for 20-30 seconds. I know that 30 seconds is more than enough, but it can help you to prevent the bacteria in the oral cavity. Then we come to the floss. We have done the cleaning with the brushing, that we have scraped the tooth surface, the remnant from the gum. But how can we clean from the interdental? Because most of the contact points, more of the gaps between the teeth, they cannot be removed. The particles cannot be removed unless we cannot use a floss. And flossing is necessary to clean that area. Now, how to use a floss is we take a piece of around 8 inch, 4 inch, and then That piece is like a form of thread. It's two types, waxed floss and unwaxed floss. And then you grab it on the middle finger, and after engaging in the middle finger, you can grab the ends with the thumb and the index finger, and then go up and down slightly in between the contact points. But don't go rapidly, otherwise you may tear the gum margins, you may spoil the gum margins. It's better to go slowly and slowly. So after doing the flossing, we can do we can use the mouthwash again, or we can do mouthwash again. Now, some recommendation for those who are, if any person is immunocompromised, or if any person is in a specific disease, or if any person is severely ill. So in that case, it's better to use disposable toothbrush. That means that you can dispose a toothbrush even after a month or after 3 months, or you use electronic toothbrush in that case. You can change the head or the bristle portion after every use, especially even in this current scenario. Regarding the diet, as you know, that Ramzan is coming, our oral cavity pH play a very important role. Normally, the pH is neutralized at 7, but in acidic conditions, whenever we take a fizzy drink, use a sugary diet, or any, at that times, what happens that our pH level is decreased. When pH level is decreased, they are going to dissolution the enamel, which causes cavity and which may affect enamel. Even in Ramadan, if we are in empty stomach whole day, and at starting or at the far time, we just directly take any fizzy drink or any citrus directly. There may be a chance, there may be complaint of acidity of teeth, there may be a chance of you can acid pH. So better to use a diet in a proper manner. Like you have to not. I didn't recommend you. You can even the sugar, right? But you can do in less frequency as compared to more frequent. And then the second thing is after you can even just like, because the whole day, if you are not drink water because of fasting, the dry mouth may also cause xerostomia, which is another cause predisposing factor caries. So it's better to take water repeatedly and hydrate your oral cavity. This is all which I need. I think it's important to discuss with at this current scenario. If anything you need to ask, welcome to our question, please.
Uh, and with that, we have actually reached the end of our session. Hello, am I audible?
Yes,
Yes.
yes. Hello.
Yes, Dr. Mariam. And with that, we have reached the very end of our session. Of course, thank you, Dr. Mariam, for taking time out of your busy schedule and guiding us through your knowledge. I hope the listeners had enjoyed the session as well. Thank you once again, ma'am.